How does ADHD develop? By Parman Harmon for the course Psych 1200 at Kwantlen Polytechnic University. This video was created for educational purposes only. ADHD, or Attention Deficit Hyperactivity Disorder, is a brain disorder marked by an ongoing pattern of inattention or hyperactivity that interferes with the functioning or development of the brain. Now we will discuss some of the causes of ADHD. One of the major and most common causes of ADHD is heredity. We will be covering the 3 case studies involving heredity, which are family, adoption, and twin studies. ADHD can be passed on through biological parents. More than 25% of first-degree relatives of families of ADHD children also have ADHD. If a child has ADHD, there is a 5-fold increase in the risk to other family members. This is the family of Dave and Denise with their son Bob. Dave and Bob are both diagnosed with ADHD. This is an example how ADHD can be passed on genetically. The next type of case study is adoption. Adopted children resemble their biological parents more than their adoptive parents with respect to hyperactivity. Although some infants adopted domestically, they do have a slight chance to be diagnosed with ADHD as well. This is Bill and Steve with their daughter Isabel at the park. Bill and Steve are ready to head home while Isabel, who is diagnosed with ADHD from her biological parents, is full of joy and wants to continue playing. This shows the difference between the genes of the adoptive parents and their adopted child. The last case study is twin studies. ADHD within twins mostly occurs when the twins are identical. Disorders transmitted should affect them the same way. There is an 82% rate for ADHD in identical twins and 38% in non-identical. This is Jack and Jill at a park. Since they are diagnosed with ADHD, they are filled with more energy to ride their bike. Their friend, on the other hand, is drained completely. The second known cause of ADHD is consuming toxic substances. Exposure to toxic substances is a bad idea for pregnant women and children. Here is Amy. She is 5 months pregnant and seems to be stressed out from the workload that she has to complete. Due to the fact she is stressed out, she decides to go to a party to relieve her stress. After consuming a couple beers, Amy is happy but unaware of the damage she is causing her child. Nicotine, alcohol, and lead can be toxic to developing brain tissues. Lead exposure in the first 3 years has an association with hyperactivity in children. The last cause we will discuss is injury to the brain. Injury to the brain due to trauma, brain tumor, stroke, or disease can cause attention deficit and poor regulation of motor activity and impulses. Although this can result in ADHD diagnosis, the occurrence of this diagnosis is not common. This is Tom. Tom got hit by a car and now he will have some chances of developing ADHD. Children with severe ADHD symptoms had smaller frontal lobes, temporal gray matter, caudate nucleus, and cerebellum. The frontal lobe functions the motor functions, concentration, language, and memory. The gray matter includes regions of the brain involving muscle control and sensory perception, such as seeing, hearing, memory, emotions, speech, decision-making, and self-control. The caudate nucleus involves inhibition, and the cerebellum coordinates voluntary movements such as posture, balance, coordination, and speech, resulting in smooth and balanced muscular activity.
Created using Powtoon.